You can request to have your disabilities reevaluated at any time. You have to prove your disabilities are worse, and you need to have a doctor help you do it. He needs to fill out the DBQ. So let's take a look at a scenario here. We have a before increase on the left side, after on the right. We got right thumb at 10, left thumb at 10, anxiety at 30, Gerd 10, migraine 0, plantar fasciitis 10, allergic rhinitis 0, tinnitus 10, hypertension not service connected. That totals up on the combined rating table at 60%. We could do some minor work here, get some increases going, boom, you're at 100%. Let's walk through it. Before I get into that, check out my boot camp if you want to get in depth. Here's what some of the folks are saying about boot camp and about the YouTube channel. Looks like Jody's kind of digging the cowboy hat, which is kind of nice. So this is something that I created for you guys. And you get access to me in the live sessions I do a couple times a month. And then this is where you can contact me through an email address. I provide an email address to all boot camp members. All right, so we have a little running tally at the bottom here, right? So we're going to first work on the thumbs. And we're going from 10 to 20. So 5228 is the diagnostic code for the thumb, limitation of motion. Right now we have a 10% rating for it. Did you know that if you have a rating for your thumb, you probably didn't even know how you got it or, the circumstances around it. If you have a less than 1 inch gap, it's 0%. If it's a gap of 1 to 2 inches, 10%. Well, it's been 15 years, you've gotten older, the gap's over 2 inches now. You should be at 20% in each hand, and you'll get the bilateral factor. So you're going to need to do this one, have a doctor fill out a DBQ for you, and that's it. You need to document the severity of your symptoms. All right, we have 9413, unspecified anxiety disorder. I used to have this, not the same rating, but I used to have unspecified anxiety disorder and depressive disorder and alcoholic use disorder and a few other disorders. So if we look down here at 30%, you can see that it says there's an occasional decrease in your social and work life. It all comes down to social and occupational impairment with all mental health ratings, PTSD, combat PTSD, depression, insomnia. There's 150 of them. So we're trying to get from 30 to 70. So we look at the law here, and we need to see that, when we got this rating, it was a little decrease. Yeah, I'm not as good as I used to be. A little bit of a decrease. We weren't really telling the truth then, because we had deficiencies in most areas of our social and work life. And that brings us up to the 70% range here. So if you have deficiencies in most areas of your social and work life, 70% rating. That's a no-brainer. We can just, we went from 20 on the left thumb, 20 on the right thumb. Now we're going to get that anxiety up to 70. You don't need more diagnosis. Anxiety's fine. You just need more social and work life issues. Want to give a shout out to the sponsor of today's video, Hill & Ponton. They're a VA accredited veterans disability law firm in Orlando, Florida. They've been helping disabled veterans nationwide for over 30 years. You can get started today by checking out hillandponton.com. 7346, hernia hiatal, Gerd, gastroesophageal reflex disease. That's a real tongue twister. I remember when I was first trying to learn how to say that. It wasn't pretty. Anyway, we started off with a 10% rating. So you have to look at the words here, and you have to look at the symptoms. I'm not going to go through every single one of these, but the most severe case of Gerd is 60%. Second most is 30, which is what we're trying to get to. And again, I'm not with these increases, I'm not trying to, go from 10 to 60 and do unrealistic stuff. I'm trying to do incremental increases that you can win based on what you already have. And you don't even need to file secondaries, but if you want to, those are available to you as well. So you need to go in and talk about your Gerd, the way that it's actually bothering you. You're now learning, wow, downplaying my symptoms didn't help me very much in 2008. Now it's 2021. Now you got to start getting this stuff documented. Code 8100. Migraines. All headaches. There's 150 of them. They're all categorized under code 8100 here. So we started off here with 0% for migraines. So if you look at the rating criteria here under 8100, this is a Cornell law, these screenshots. So with less frequent attacks, if you didn't know that you had to talk about your frequent attacks, then you got a 0% rating. That's exactly what happened in this scenario. So you probably didn't know about prostrating either, or prostrating, not to be confused with prostate. If you have attacks averaging 1 and 2 months over the last couple of months, 10% rating. If you have an average of once a month, 30% rating. That's what we're going for here. We're just trying to go from 0 to 30. If you have migraines once a week or more, 50% rating. So this is an easy one to get a increase on as well. 5269. Plantar fasciitis. What's up, plantar fasciitis? I hate it. I have it in both feet. It's horrible. So when you got your rating here, 10%, it was you were downplaying it. You didn't talk about how bad it hurt. Who are you going to tell? Like, you have to deal with it. Nobody's going to help you. Nobody's coming and sending you a lifeboat or anything like that. So as you go up, no relief from both non-surgical and surgical treatment, unilateral. No relief from both non-surgical and surgical treatment, bilateral. So bilateral is both feet. I have a 50% rating. Plantar fasciitis is the bulk of my foot rating. I have metatarsalgia, calcaneal bone spur, and pes planus, flat feet. So I get no relief from the orthotics. I get no relief from the taping, the shots, all that stuff. No relief. So that's a 30% in each foot. So I have, and then they have the dominant foot. So you get 30 in the dominant foot and then 20 in the other foot. So that's how I ended up with 50. 6522, allergic rhinitis. Go look up 6522 and without polyps, 10%. With polyps, 30%. If you have this stuff, you have it. If not, move on and go work on increasing something else.